Hello everyone, and welcome to this audio podcast. This audio podcast, as part of the Haemotoxy, this audio podcast as part of the Bostics and Baraga, and this audio podcast as part of the specials. This audio podcast as part of the Express and Caliber. This audio podcast as part of a Storm Logistics production. In this audio podcast, and looking at our works by science student Hussain within an academic institution in the United Kingdom or UK, not looking into sort of some additional elements of histopathological laboratory staining investigations. So H&E, hemotoxin and eosin is primarily unable or to unable is unable or is unable to sort of stain to stain M tuberculosis cell walls, which contain mycolic acids, that which gives them sort of a high sort of a bilayer or content in around and the surrounding in around the bases of the sort of the cell, M tuberculosis cell structure. This then consequently or subsequently makes M tuberculosis sort of difficult or challenging to stain in its entirety. Obviously, as mentioned, viewers and listeners, that in the previous audio podcast, it is said that a hemotoxin and an eosin can help bring out some of the components some components of M tuberculosis under microscopy. However, M tuberculosis is generally or can be difficult or challenging to stain in its entirety. Despite this, however, investigations such as tinctorial staining can be utilized to selectively dye M tuberculosis, and due to its sort of resistance and to decolorization. So, for example, hemotoxin and eosin sort of helps bring out certain or particular cell components, and as said, the hemotoxin and eosin staining or H&E staining also bring the colorization of cells under microscopy, but at the same time, there is a basis of where where M tuberculosis has M tuberculosis can also prompt some sense of resistance to the decolorization. And so, due to its resistance to decolorization agents such as hydrochloric acid or hydrochloric acid alcohol decolorizer, M tuberculosis is sort of classed as a species at the same time as acid-fast bacilli. This characteristic can be exploited or investigated through diagnostic and within diagnostic environs by additionally using what's referred to as carbon fusion-based staining investigations, which are able to quickly permeate the M cell walls or Mycobacterium cell walls, and stubbornly sort of retain the dye after decolorization. Whereas non-acid fast bacilli and cell debris release carbon fusion and readily decolorize. Additionally, carbon fusion can be carbon fusion staining investigations can be utilized as a primary stain due to acid due to help dye and again sort of bring out acid fast mycobacteria in mycobacteria and whilst non acid fast bacilli cells and field debris can be counterstained to contrast and thus allowing for a sort of a sort of differentiation under laboratory sort of microscopy investigations. Nielsen is also a carbon fusion based stain or investigation utilized to dye acid fast bacilli. However, it requires heating to penetrate mycobacterium walls. So Hussain then. Hussain, the science student, then informs of on this in around Kinune carbon fusion Kinune carbon fusion staining or histopathology staining. So Kinune carbon fusion staining, however, can be used to stain mycobacterium through a cold staining methodology, and where Kinune carbon fusion staining is additionally a selective laboratory staining that is used to identify acid fast bacilli such as Mycobacterium tuberculosis as part of tuberculosis diagnoses, and at the same time it can be used or utilized to identify acid fast bacilli if present for example this patient this patient cases pulmonary lobectomy specimen. Moreover, H&E staining, additionally combined with Kinune carbon fusion staining, can highlight granulomatosis, inflammation, and acid fast bacilli presence accordingly, and ultimately through the combination of histopathological staining investigations to determine tissue and cell sort of normality and abnormality, the laboratory staining investigations can help provide a definitive diagnosis of whether or not where a patient, or in this case where patient is suffering or has been suffering from M. tuberculosis. So that draws this audio podcast to a close. This audio podcast is part of the Haemotoxy. This audio podcast is part of the Bostics and Baraga and the specials. This audio podcast as part of the Express and Caliber, and this audio podcast as part of a Storm Lobostics production.